Have you ever been jolted out of sleep at 2 in the morning? Heart racing, calf muscle locked, toes curled, pain so sharp you can't even breathe? If you nodded, I want you to know you're not alone. Every week I hear this exact story from my senior patients. And not just once. Some of them suffer from these cramps several nights a week. They describe the pain like a vice, twisting their muscle like it's being wrung out. One of my patients, a 71-year-old retired teacher, told me she started dreading going to bed because she knew the cramps were waiting for her in the dark. And here's the thing. Nighttime leg cramps aren't just uncomfortable. They rob you of your sleep. They can increase your risk of falling when you jump out of bed. And over time, they chip away at your energy, your balance, and your confidence. But here's the good news. Most leg cramps are preventable. And I'm going to show you exactly how. Not with medication, not with guesswork, but with simple, safe, doctor-backed steps that have helped hundreds of my patients sleep through the night without pain. So if you're tired of being interrupted by those muscle spasms, if you're looking for real relief that respects your age, your body, and your health conditions, stay with me. Because by the end of this video, you'll have a plan you can start using tonight. Let's take a moment to really understand why these nighttime leg cramps happen, especially as we age. Because once you understand the root causes, you'll be in a much better position to stop them before they strike. Now, muscle cramps, especially at night, are involuntary contractions. They come on suddenly, they're often intense, and they can last anywhere from a few seconds to several minutes. But what causes them? From a medical perspective, here are the 5 most common triggers I see in my patients over 60. 1. Mineral imbalances, especially low magnesium, potassium, and calcium. As we age, our body becomes less efficient at absorbing essential minerals, even if we're eating well. And these minerals, especially magnesium, potassium, and calcium, play a critical role in muscle relaxation. Magnesium helps regulate nerve function and muscle contractions. Potassium helps muscles contract and communicate with nerves. Calcium allows muscles to contract properly and then relax afterward. When any of these get too low, whether due to poor diet, dehydration, or certain medications, the electrical signals that control your muscles can misfire, and bam, a cramp. 2. Mild dehydration, especially overnight. A lot of older adults simply don't drink enough water, and not because they forget. Some avoid it on purpose to reduce nighttime bathroom trips. But even mild dehydration can concentrate your electrolytes and disrupt muscle function. And remember, we naturally lose water while we sleep, through breathing, sweat, even dry bedroom air. So if you go to bed already a bit dehydrated, your muscles may not have what they need to relax fully. 3. Medications that interfere with muscle function. Several common prescriptions can trigger cramps as a side effect. The most frequent culprits I see are diuretics, often prescribed for high blood pressure or heart failure. They flush out water and potassium. Statins, used to lower cholesterol, but they can sometimes irritate muscle tissue. Beta blockers, which affect circulation and muscle oxygenation. If you've recently started a new medication and noticed more cramps, it's absolutely worth bringing up with your doctor. You may not need to stop the medication, but you might need a tweak in dosage or diet. 4. Poor circulation and prolonged inactivity. Muscles need a steady supply of oxygen and nutrients to stay healthy, and movement helps with that. But when we sit too long or sleep in certain positions, blood flow to the legs can slow down. That's why cramps often strike in the calves. They're the farthest point from your heart, and they're working against gravity all day. Even just a short walk after dinner or a simple stretching routine before bed can significantly improve circulation and reduce your risk of cramping. 5. Underlying health conditions. Sometimes leg cramps are a warning sign of deeper health issues. In older adults, I always screen for the following. Diabetes. High blood sugar over time can damage nerves and blood vessels, leading to misfiring muscle signals. Peripheral artery disease, PAD. Narrowed arteries reduce blood flow to your legs. Hypothyroidism. Low thyroid levels can cause stiff, cramping muscles. If your leg cramps are frequent, worsening, or happening alongside numbness, swelling, or fatigue, please don't brush them off. These could be clues your body's trying to send you. Now you might be wondering, Dr. Harrison, which one of these is causing my cramps? And that's a great question. In most cases, it's not just one factor, it's a combination. Maybe your magnesium levels are low, plus you're taking a diuretic, plus you didn't drink enough water yesterday. The good news is, once we understand the causes, we can build a plan that works with your body, not against it. And that's exactly what we'll do in the next part of this video. Let's begin with the first, and in many cases, most effective, strategy I recommend to my patients. Boost your intake of magnesium and potassium through whole foods. Now, I know some people jump straight to supplements, but as a physician, I always start with food first, because the body absorbs nutrients from food more efficiently, and there's less risk of overdoing it. So why these two minerals? Because magnesium and potassium are absolutely essential for healthy muscle function, especially for helping muscles relax after they contract. If either one is too low, the electrical signals that control your muscles can misfire, leading to those painful cramps in the middle of the night. Let me break them down for you. Magnesium, the muscle relaxer. Magnesium acts like a calm down signal for your muscles. It helps prevent overexcitability in the nerves and allows muscles to release after they contract. As we age, our magnesium levels naturally decline due to reduced absorption, lower intake, and medications that flush it out, like diuretics. If you're low in magnesium, you may experience leg cramps, muscle twitching, fatigue, difficulty sleeping. That's why I often recommend foods that are rich in magnesium glycinate and magnesium citrate. But again, whole foods come first. Here are my top magnesium-rich foods I recommend to patients. Pumpkin seeds, one of the best sources. Just a handful, about 1 ounce, gives you nearly 40% of your daily magnesium. Spinach, cooked. 1 cup gives about 150 milligrams. Black beans, great for fiber and magnesium. Half a cup gives around 60 to 70 milligrams. Avocado, half an avocado provides about 50 milligrams. Dark chocolate, 70% or higher. 1 square can give you a small magnesium boost, and it's a guilt-free treat. If you can include just 2 to 3 of these in your meals each day, you'll be supporting your nervous system and muscles in a very powerful, natural way. Potassium, the electrical stabilizer. Now let's talk about potassium. Potassium helps regulate the flow of electricity in your muscles and nerves. Without enough of it, muscles may cramp, weaken, or feel tight. A low potassium diet is especially common among seniors, partly due to low fruit and vegetable intake, and also because some medications, again diuretics especially, cause potassium loss through the urine. Here's what I often recommend to naturally raise potassium. Again, through food. Top potassium-rich foods for older adults. Bananas. 1 medium banana has around 420 milligrams of potassium. Sweet potatoes. Just 1 medium baked sweet potato gives about 540 milligrams. White beans, excellent source. Half a cup can contain over 450 milligrams. Coconut water, naturally high in potassium and a good low-sugar hydration option. Beet greens, over 300 milligrams per cooked cup. But not everyone enjoys the taste, so try blending them into soups or smoothies. A simple day's sample plan. To give you an idea of how to put this all together, here's a sample plan I might suggest to a patient. Breakfast. Oatmeal topped with banana slices and chia seeds, a small magnesium bonus. Lunch. Spinach and black bean salad with olive oil and lemon. Snack. Pumpkin seeds with a piece of dark chocolate. Dinner. Baked salmon, roasted sweet potatoes, and sautéed beet greens. It's not about being perfect. It's about being consistent. Over time, even modest improvements in your mineral intake can dramatically reduce cramping. A note of caution: when to talk to your doctor. Now, before you overhaul your diet, there are a few important considerations. If you have kidney disease, your body may not filter potassium properly. High potassium can be dangerous. Please consult your doctor first. If you're on potassium-sparing diuretics ACE inhibitors or ARBs, ask your physician before increasing potassium intake. If you're diabetic, be cautious with fruits and starchy vegetables. Choose lower glycemic options and balance them with protein. Bottom line, if your body doesn't have the right building blocks, your muscles simply can't relax the way they should. Food is medicine, and in this case, it's also one of your strongest defenses against nighttime leg cramps. In the next strategy, I'll show you how to optimize your hydration, including when to drink, what to add, and how to do it without waking up to use the bathroom 3 times a night. Now let's talk about a strategy that's simple, free, and often overlooked, but incredibly effective when done right. Hydration. Yes, drinking water sounds basic, but as a physician, I can tell you how and when you hydrate matters just as much as how much. Because here's the truth. Many of my older patients are unintentionally dehydrated, not dangerously dehydrated, just a mild chronic dehydration that flies under the radar. And that's exactly the kind of environment where leg cramps love to thrive. Why dehydration triggers cramps? When you're even slightly low on fluids, your blood becomes more concentrated. This throws off your electrolyte balance, especially sodium, potassium, and magnesium, and makes your muscles more excitable, more irritable, and more likely to cramp. And remember, we lose water naturally through breathing, sweating, urination, and digestion. At night, this problem can get worse. We're not drinking, but we're still exhaling moisture with every breath. Add in dry indoor air or a fan blowing near your face, and you may wake up more dehydrated than you realize. The right timing matters, especially at night. Now here's the catch. A lot of seniors tell me they avoid drinking water after dinner because they don't want to be up all night using the bathroom. I understand that completely. But skipping water entirely can backfire because dehydration itself can trigger nighttime cramps. So here's what I suggest to my patients. Dr. Harrison's nighttime hydration plan. Hydrate gradually during the day. Aim to drink small amounts of water consistently throughout the day, not just one big glass here or there. A good target for most seniors is about 6 to 8 cups, 48 to 64 ounces of total fluids per day, unless your doctor tells you otherwise. Stop large fluids about 2 hours before bed. This gives your kidneys time to process excess fluids, so you're less likely to wake up needing the bathroom. But don't stop completely. Have a pre-bed sipper, just 3 to 4 ounces. About 20 to 30 minutes before bed, drink a small glass, about half a cup, of water. It's enough to prevent overnight dehydration, but not so much that it disturbs your sleep. This can make a big difference in overnight cramping, especially if combined with electrolytes. Optional, add natural electrolytes. If you sweat a lot, take diuretics, or notice that plain water isn't helping, you might benefit from a gentle electrolyte boost. I often recommend this simple at-home mix to patients. Half a cup of water, a tiny pinch of sea salt, rich in natural sodium and trace minerals. A squeeze of lemon adds flavor and a bit of potassium. Optional, a few drops of coconut water for extra potassium. This natural mix helps your body retain water better and restores key minerals that muscles rely on to relax. Alternatively, you can use a low-sugar electrolyte powder, but check the ingredients. Avoid artificial sweeteners or high sodium unless directed by your doctor. When to be cautious. If you have any of the following conditions, you should talk to your healthcare provider before increasing fluid or electrolytes: chronic kidney disease, congestive heart failure, severe urinary incontinence, or if your doctor has placed you on fluid restrictions. The goal is always balance. We want enough hydration to prevent cramps, but not so much that it causes other issues. Bottom line, dehydration is one of the most preventable causes of nighttime leg cramps, and yet it's also one of the most underaddressed. By drinking the right amount at the right times and with the right balance of electrolytes, you can give your muscles the support they need to stay calm and cramp-free through the night. And in our next strategy, I'll show you a simple 2-minute stretch that's been clinically shown to cut nighttime cramping in half, especially in the calves. It's easy, safe, and you can do it right before bed. Now let's move on to one of the most simple, safe, and often surprisingly effective tools in preventing nighttime leg cramps. A bedtime stretching routine. Yes, just 2 to 3 minutes of gentle stretching before bed can dramatically reduce the frequency and intensity of those painful muscle spasms that wake you up at night. And I'm not just saying that based on experience. The science backs it up. The research behind it. In a 2020 clinical study published in the Journal of Geriatric Physical Therapy, older adults who performed calf stretches every night before bed saw a 58% reduction in nighttime leg cramps after just 4 weeks. That's more effective than many medications, and it comes with zero side effects. The reason? Stretching improves circulation, supports nerve signaling, and helps muscles reset their resting length, making them less likely to spasm involuntarily during sleep. Why stretching matters for seniors. As we age, muscles naturally lose flexibility and tone, especially if we sit a lot during the day. This tightness tends to settle in the calves, hamstrings, and feet, which are also the most common sites for nighttime cramps. Think of stretching as setting the tone for your muscles overnight, telling them to relax, reset, and let go of unnecessary tension. Dr. Harrison's pre-bed stretching routine. Here's the exact sequence I give to many of my patients. It's gentle, safe, and can be done next to your bed. 1. Calf wall stretch, 30 seconds per leg. How to do it. Stand facing a wall. Place your hands on the wall at shoulder height. Step one leg back, keeping that heel flat on the ground. Keep your back leg straight and your front knee slightly bent. Lean forward gently until you feel a stretch in the back calf. Hold for 30 seconds, then switch sides. Why it works. Stretches the gastrocnemius, the most common site of nighttime cramping. 2. Seated hamstring reach, 30 seconds per leg. How to do it. Sit on the edge of your bed or a chair. Extend one leg straight out in front of you, heel on the ground, toes up. Gently lean forward from the hips, reaching toward your shin or foot. Don't force it. Hold for 30 seconds, then switch legs. Why it works. Lengthens the hamstrings and helps ease tension that can pull on the calves. 3. Toe flex and point, 30 seconds both feet. How to do it. While seated or lying in bed, flex your toes upward toward your face, dorsiflex. Hold for 5 seconds. Then point them forward, plantar flex. Hold for 5 seconds. Repeat 5 to 6 times. Why it works. Improves circulation to the feet and ankles, retrains the nervous system to control muscle length smoothly. Optional, foam rolling or massage, 1 minute. Use a foam roller or massage ball gently on your calves or feet for about 30 to 60 seconds. Alternatively, massage the area with your hands in slow circular motions. Why it works. Releases built-up tension in the fascia and muscles that might contribute to spasms. When to do it. Do this 10 to 15 minutes before bedtime, ideally after brushing your teeth or turning down your bed. Try to make it part of a calming, consistent evening routine, because not only can it reduce cramps, it also signals your nervous system that it's time to wind down. Safety tips for older adults. Never stretch to the point of pain. You should feel gentle tension, not sharp discomfort. If you have balance issues, perform the stretches with support, like next to a bed, wall, or sturdy chair. If you've had recent hip or knee surgery, check with your physical therapist before starting any new movement routine. Bottom line, you don't need to be an athlete or go to yoga class to get real benefits from stretching. Even simple, low-effort movements can make a huge difference in how your legs feel overnight. So before you turn out the lights tonight, take 2 minutes to stretch. Your calves will thank you in the morning. In the next part, we'll talk about a critical but often forgotten step. Reviewing your medications with your doctor, because the answer to your cramps might already be in your medicine cabinet. Now let's talk about something that's often hiding in plain sight, your medications. In fact, if you're doing everything right, eating well, staying hydrated, stretching, but you're still experiencing nighttime leg cramps, one of the first things I check as a physician is what medications you're taking, because several commonly prescribed drugs, especially for older adults, have leg cramps as a known side effect. How medications can trigger leg cramps. Some medications affect how your body uses minerals. Others interfere with circulation, nerve signals, or muscle metabolism. And in many cases, the cramps aren't immediate. They can develop weeks or even months after starting the medication, which is why many patients don't make the connection right away. Let's go through the most common culprits I see in my clinic. 1. Diuretics, water pills, often prescribed for high blood pressure, congestive heart failure, kidney disease. Why they cause cramps? Diuretics increase urination, which flushes out not just excess fluid, but also vital minerals like potassium, magnesium, and sodium. The result? Electrolyte imbalance, one of the top triggers for muscle spasms. Common examples: furosemide Lasix, hydrochlorothiazide, HCTZ, bumetanide. 2. Statins, used to lower cholesterol, reduce cardiovascular risk. Why they cause cramps? Statins may cause muscle inflammation or disrupt mitochondrial energy production, leading to muscle pain, weakness, or cramping in some people. This doesn't happen to everyone, but it's something I always consider if a patient develops new muscle symptoms after starting a statin. Common examples: atorvastatin, Lipitor, simvastatin, Zocor, rosuvastatin, Crestor. 3. Beta blockers, used to treat high blood pressure, heart arrhythmias, migraines. Why they cause cramps? They can reduce blood flow to the limbs, which may increase the risk of muscle fatigue and spasm, especially in colder weather or during the night when circulation slows down. Common examples: metoprolol, propranolol, atenolol. 4. Inhalers containing beta agonists, used for asthma, COPD. Why they cause cramps? These medications can lower potassium levels slightly, especially with frequent use, and that can trigger cramping in sensitive individuals. Common examples: albuterol, salmeterol. What should you do if you suspect a medication is causing cramps? First and foremost, never stop or change your medication on your own. Even if you're sure it's the cause, always speak with your doctor first. Here's what I recommend. Dr. Harrison's Medication Review Checklist. Make a complete list of every medication and supplement you take, including over-the-counter meds, vitamins, and herbal remedies. Write down when your cramps started, and whether they got worse after starting or adjusting any medications. Schedule a review with your primary care physician or pharmacist. Bring your list and explain your symptoms clearly. Ask about alternatives or dosage adjustments. In many cases, there's a substitute medication or a simple adjustment that can relieve symptoms without sacrificing treatment. Don't forget supplements. Even natural remedies, like high-dose vitamin D, calcium, or herbal diuretics, can contribute to cramping if misused. Bottom line, if you're over 60 and taking prescription medications, there's a very real possibility that your leg cramps are being triggered or worsened by something in your daily pill box. But the good news is you're not stuck. With a proper medication review, many of my patients have been able to dramatically reduce or even eliminate their nighttime cramps, often without adding anything new, just by adjusting what's already in place. And next, we'll explore one final powerful strategy: the safe and smart use of magnesium supplements, and how to know if they're right for you. Now let's talk about one of the most talked about and often misunderstood solutions for nighttime leg cramps: magnesium supplements. Chances are you've seen them in pharmacies or heard friends swear by them. And yes, in many cases, magnesium really can help reduce the frequency and severity of nighttime cramps. But it's important to use it the right way, especially as we get older. Why magnesium helps with muscle cramps? Magnesium is essential for nerve conduction, muscle contraction, and, most importantly, muscle relaxation. Without enough magnesium, your muscles become hyperactive. They're more likely to contract spontaneously, leading to those sudden, painful spasms that wake you up in the middle of the night. Unfortunately, magnesium deficiency is surprisingly common in older adults. Why? Our bodies absorb less magnesium from food as we age. Diuretics and certain medications can flush magnesium out, Diets low in leafy greens, seeds, and legumes don't provide enough. Even mild magnesium deficiency can trigger leg cramps, muscle twitching, restlessness, difficulty sleeping. What the research says, multiple clinical studies have explored magnesium supplementation for muscle cramps, especially in older populations. While results vary depending on the cause of cramping, several trials have shown that magnesium glycinate and magnesium citrate may significantly reduce nighttime cramps when taken consistently for 2 to 4 weeks. These forms are gentle on the stomach, highly absorbable, and less likely to cause digestive upset than cheaper forms like magnesium oxide. Dr. Harrison's Magnesium Guidelines for Seniors. If you're considering magnesium, here's what I typically recommend to my patients. Start low and go slow. Begin with 200 milligrams per day, preferably taken in the evening with or after food. If well tolerated and cramps persist, you can increase to 350 milligrams daily, but only under medical guidance. Choose the right form. I recommend magnesium glycinate, best for sleep, anxiety, and muscle relaxation. Magnesium citrate, good absorption, may help with mild constipation. Avoid magnesium oxide, poorly absorbed and more likely to cause diarrhea. Give it time. Don't expect results overnight. Most people notice improvement in 7 to 14 days, with full benefit in about 3 to 4 weeks of consistent use. When not to take magnesium. Without a doctor's advice, magnesium is generally safe, but there are important exceptions. Avoid or carefully monitor magnesium supplementation if you have chronic kidney disease, reduced ability to clear excess magnesium, are on dialysis. Take medications that interact with magnesium, such as certain antibiotics, blood pressure medications, for example, calcium channel blockers, muscle relaxants. Already take magnesium-containing antacids or laxatives. Always review new supplements with your doctor or pharmacist, especially if you're taking other medications or managing chronic conditions. What to look for on the supplement label. When shopping for a magnesium supplement, choose a product that lists elemental magnesium content clearly. Look for third-party testing labels, such as USP, NSF, or Consumer Lab. Avoid products with unnecessary fillers, dyes, or artificial sweeteners. And remember, magnesium works best as part of a complete approach that includes nutrition, hydration, stretching, medication awareness. Bottom line, magnesium isn't a magic bullet, but it can be a powerful tool in your toolkit for preventing leg cramps. When used correctly with the right form, dose, and medical awareness, it's a safe and effective way to restore balance to your muscles and help you sleep more peacefully through the night. In the next part of this video, I'll bring it all together with a 7-day anti-cramp action plan that combines all 5 strategies into a simple routine you can start tonight. Now that you understand the root causes of leg cramps and the 5 doctor-approved strategies to prevent them, it's time to bring it all together into something doable, something you can start tonight. This is your 7-day anti-cramp action plan, designed specifically for older adults, based on clinical evidence and real-life patient success. Each day will build on the previous one. The idea isn't perfection, it's gentle, sustainable progress. You don't need fancy equipment, supplements, or apps. Just a commitment to follow this plan, day by day, for 1 week. Ready? Let's walk through it together. Day 1, awareness and hydration. Reset, track your water intake from morning to bedtime. Goal, approximately 6 to 8 cups or 48 to 64 ounces, unless your doctor says otherwise. Begin spacing your fluids throughout the day. Avoid large amounts after 8 p.m. Before bed, drink 3 to 4 ounces of water with a pinch of sea salt and a squeeze of lemon. This helps with gentle overnight hydration. Optional, begin a simple leg journal. Include the time cramps occur, intensity on a scale of 1 to 10, and what you ate or drank that day. Day 2, nutrition for muscle support. Add 2 magnesium-rich foods to your meals. Examples include spinach, black beans, pumpkin seeds, or avocado. Add 1 potassium-rich food to your plate. Examples: banana, sweet potato, or coconut water. Keep hydrating as on day 1. Note in your journal how your legs feel in the evening. Day 3, movement and stretch activation. Begin your 2-minute bedtime stretch routine. Refer to Dr. Strategy number 3. Calf stretch using a wall, seated hamstring reach, toe flex and point. In bed. Do this 10 to 15 minutes before bedtime. Continue magnesium and potassium-rich meals. If you're able, take a gentle 10-minute walk after dinner. Day 4. Medication awareness. Check in, review your current medications. Look for diuretics, also known as water pills, statins, beta blockers, inhalers. Note any you've started or adjusted in the last 1 to 3 months. Write down questions for your next doctor's visit, such as, could this be contributing to my leg cramps? Keep doing your stretch routine and nutrition plan. Day 5. Consider magnesium supplementation. If you've had 3 or more cramps this week and you have no kidney issues, consider adding 200 milligrams of magnesium glycinate in the evening. With food. If you've had no cramps or only mild symptoms, you may continue with food-based sources of magnesium. Monitor for any digestive changes, such as soft stools or gas. Continue hydration, stretching, and journaling. Day 6. Build consistency. Repeat everything from day 5. Reflect on your evening routine. Is it calming? Avoid screen time for 30 minutes before bed. Consider a light massage or warm compress on your calves. Note any improvements in the frequency or intensity of cramps. Day 7. Evaluate and personalize. Review your 7-day journal. Which strategy helped most? Were there any patterns, such as time of day, missed hydration, or changes in meals? If you're noticing fewer or less intense cramps, congratulations. If not, don't worry. You may need a higher magnesium dose with medical guidance, adjustments to your medications, more time. Some improvements take 2 to 3 weeks. Remember, progress, not perfection. Beyond day 7, what now? Once you've completed the plan, keep the habits that worked for you. Bring your journal to your next doctor's appointment. If cramps return later, revisit this 7-day reset. This isn't just a plan. It's a tool you can use anytime cramps flare up again. Final note from Dr. Harrisson. If you've made it this far, I'm proud of you. You're not just managing symptoms. You're taking your health into your own hands, one small step at a time. These changes may seem small, but together they can restore something powerful. Peaceful, uninterrupted sleep, stronger, calmer legs, and confidence in your body again. In the final part of this video, I'll summarize the 5 core strategies and share one last message for everyone on this journey. All right, let's bring it all together. We've covered a lot today, and I want to make sure you leave not just informed, but equipped. Here's a quick recap of the 5 doctor-backed strategies we've explored. 1. Boost magnesium and potassium through food. Support your muscles from the inside out, with minerals that help them relax and reset. 2. Hydrate smartly throughout the day. Prevent dehydration without sacrificing your sleep by using the right timing and a gentle electrolyte boost. 3. Stretch before bed, just 2 minutes. A simple, proven routine to signal your muscles. It's time to rest. 4. Review your medications. Identify hidden culprits that may be silently triggering your cramps, and speak with your doctor about safe adjustments. 5. Consider magnesium supplementation. When food alone isn't enough, targeted support may help your body rebalance, especially if you're over 60. And to bring it all together, you now have a 7-day action plan that simplifies these steps into something you can actually do at your pace, in your home, starting tonight. Before I let you go, let me say this. Nighttime cramps may feel like just another part of aging, but they're not something you have to accept. You don't need to suffer in silence. You don't need to dread bedtime anymore. You have options, you have tools, and most importantly, you have the power to take small, consistent actions that lead to real relief. Now I want to hear from you. Have you tried any of these strategies before? What's worked? or what hasn't in your experience? Do you have questions about your unique case? Let me know in the comments. I read everyone, and your story may help someone else who's quietly struggling too. If you found this video helpful, click that like button. It helps this information reach more people. Subscribe to Pure Vibe Health for weekly, doctor-trusted videos just like this one. And most importantly, share this video with someone you care about, a spouse, a sibling, a neighbor, who's quietly suffering from leg cramps and deserves real answers. I'm Dr. Michael Harrison, and as always, thank you for trusting me with your time and your health. Sleep well, stay strong, and I'll see you in the next video.